You know those parents who admit they don't have all the answers, but somehow make you feel better about your own chaos? That's Pondering Parenthood. Megan and Mike are fellow Vermonters who talk openly about the real stuff: sleep deprivation, meltdowns, and the moments that make it all worth it. No experts, no judgment, just honest conversations that'll make you laugh, cry, and maybe breathe a little easier. Seriously, go give Pondering Parenthood a listen. You'll feel right at home. Welcome to Quiet Connection, a podcast dedicated to ending the stigma around postpartum mental health. I'm Chelsea. Today, I'm joined by Dr. Sandra Fernandes, a former family physician, mom of two, and burnout coach for women who feel like they're drowning in the pressure to do it all. We talk about pregnancy loss, control, burnout, and what happens when life refuses to follow the plan. If you've ever felt like you were silently struggling, this one's for you. Let's hear from Sandra. Hello! Today I'm here with Sandra. Sandra, how are you?
I'm good. Thank you so much for having me.
Thank you so much for being here. I feel like I'm on repeat lately, but Sandra is another guest who has been so flexible with me. We as moms know that life is insane, and we've had to play a little bit of schedule tag, but we're here and we're doing it. We made it on a Wednesday morning. So I appreciate you being here. What I really love to do is ask my guests if they or you could describe who you are today, sitting here with me, and then who you were before your parenting journey.
Okay. So I am a mom of two little ones and a dog mom. We were just talking about our dogs. And I am a wife. I'm also a coach for women who are silently struggling in the stress and overwhelm of the day-to-day, but want to be able to do it all without drowning in it all. And my background is as a family physician, where I would see patients, and a lot of my experiences there, along with my personal, mothering experiences, really kind of shaped where I'm at and what I do nowadays. And your question about who I was beforehand, right?
Yeah.
And I love that that phrasing, because I think it kind of normalizes the fact that we can be different people before there's a pre and a post, and that's normal. And we're not expected to bounce back to the person we were, because I think it does change you, and that's normal, and that's expected, and that's okay. I, for one, was very type A, perfectionist, overachiever. That's how I would describe myself. A little background: I immigrated here when I was very little, from Portugal. And so I think I grew up with that American dream mentality. I really got to see that. My parents really lived that, having not been educated and then really been able to build a successful life here. So I think I really firmly believed that if I work hard, if I really work hard, I can achieve anything I want. And that worked for a very long time for me. I did work really hard, and I checked all the boxes. I did all the things that, I felt like I wanted to do or needed to do. But then, I think motherhood was really sort of the beginning of unraveling of all of that in so many ways.
Yeah, and we're going to get into it for sure. But I also love that you highlighted that, because one of the themes that I find so often with moms, I talk to a lot of type A overachieving moms, which is interesting to me. There's a lot, yeah. But then also, I do intentionally ask that question about who you were before the journey started. Not necessarily who you were before becoming a mom, but even before making the decision to become a mom, because really you're going to change, you're going to evolve. And that's just the journey of life, whether you have kids or not. So I appreciate you calling that out. It means I'm asking the right questions.
Yes, I think so. I like that question.
So let's kind of get into it. I love learning about you. You were a hard worker. You saw the results of your hard work for a very long time. Did you always envision yourself having children?
So I did. I think I knew I definitely wanted to have children one day, but I had a very specific, as I said, almost like checklist or time frame, I would say it more so, about all of these things need to happen before I can have kids. It was like, well, I need to finish all of my career training, right? And in medicine, that's a very long process, right? So I need to do that. I need to get a job. I need to be at that job for at least a year because, I don't want them to think that like I'm just going to be out on maternity leave right away. No, I'm committed to this job, right? And so I had all these stories I told myself. I need to buy a house. I need to, be married. I need to blah, 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 right? So I had sort of this checklist that I had created. So I knew I wanted to become a mom, but it was sort of like, well, I'm going to get to that. I'm going to get to that. I'm going to get to that. And knowing very well, right, that there's sort of a time, like there's a window where things are, easier or less risky or whatever you want to call it, but very much feeling like I need to do all of these other things. So that was kind of how I envisioned it.
It was part of your checklist. It was,
Yes.
again, that, yeah, going back to type A, you had a plan.
Mm-hmm.
So talk to me about that. So obviously you met your partner, both, I'm assuming, had that discussion. When did you decide, like, okay, now is the time? Now, like, I feel like my checklist, I've checked these boxes. This is the next one to check off.
Yeah. So, and it's interesting because I think my husband and I, we had been together for quite some time actually before, having kids. And it was 100% my call because I was like, I'm not ready yet. Nope. I got to do this. I got to, and where I think he would have been fine much sooner. So I think it really was when I felt established in my career. I felt settled in terms of where we were living, I felt like I had my ducks in a row. And I think that I had also felt like, okay, I've traveled, I've done all these different things. Like I'm ready to, I hate to say it this way, but I'm going to be honest about how I was thinking of it. Like I'm ready to not be selfish anymore. I'm ready to, now kind of put my priorities somewhere else. And I think when I got to that point, that's when I felt like, okay, we can have a kid now, we can have a baby. Let's do this. But, it wasn't as, that part didn't follow my checklist as easily.
No, it didn't. And we're definitely going to talk about that because that was interesting when I was, like I said, I always say I don't like to learn too much about my guests beforehand. I want to get to know you in the moment. But when I was kind of reading what you had sent me, I was like, oh, yeah, that did not check the check boxes. So, yeah, and we could talk about that. I have a few different angles I want to approach that from, but I love how you put it, though, because it is a conscious decision. You do have to decide, like, I'm going to focus my energy and myself on providing for someone else. I totally vibe with that. Yeah, so you decided to start the journey and it didn't go exactly the way you planned. Can you talk to me about that a little bit?
Yeah. So first of all, it was taking a lot longer than we had wanted to. Like I said, I had been at my job for a year and I was like, okay, by the time I get pregnant, it'll be almost 2 years or whatnot. And it was almost like another year of trying. And we, eventually did get pregnant, but it ended up being an ectopic pregnancy. And so that was in and of itself, just, I think, a very torturous and complicated situation because this was our very, very first pregnancy. And it was so desired. We had waited for so long. And the way it happened for me was not clear cut. So, and this is this, I think everybody's birth stories and pregnancy stories are so different. And even within ectopics, right? And I'm sure we'll get to it, but I ended up having more than one, right? And even
Yeah.
for myself, each experience was wildly different. So for that, the first one, we didn't really know what was going on for a long time. I had been spotting and bleeding, and, I saw a doctor and they were not sure what was going on. They were like, this could be a miscarriage, but it could be an ectopic, but it could be a viable pregnancy. We don't know, because my dates were very irregular. There was a lot of conflicting things. My labs were going up like a pregnancy should, but not exactly at the rate it should. Like there was a lot of details that made it very confusing. And so that sort of not knowing what is going on, but you're dearly like holding on to hope, but also trying to prepare yourself for the worst, was a very prolonged experience. And so it really changed how I looked at everything, because I didn't know how to feel in the moment. And I think that for somebody who was very used to planning everything, right, and to
Mm-hmm.
having things falling for tea, and I knew, as a doctor, like I knew that there miscarriage is a lot more common than we talk about, and all of these different things. But ectopics are even more rare. I think it's like 1 or 2% of people, pregnancies end up in ectopics, and I had no risk factors. And I was like, but I'm spotting, and I know patients who spot and go on to have normal pregnancies. Like maybe this is going to be just fine, right? So that waiting period was the absolute worst. I think I think at a certain point I was like, I'm okay if this is a loss. I just want to know. Like
Yeah.
I just want to know, so I can kind of start to process and move on. And there was a lot of back and forth. And then the treatment, when we finally got to the point where we felt confident enough that this is truly an ectopic, was also prolonged, because I got a methotrexate injection. And so that takes, about a month or so for your levels to actually go back down to zero. And so that whole time you're still at risk of rupture, and, which that idea, right, was terrifying.
Yeah.
They're constantly like, well, you can't lift heavy things. You can't do any, I had all these trips and vacations, and this was in the summer. I had all these events planned, and they're like, you can't go, you can't do this, you have to be 30 minutes from a hospital. It was a lot. It was a lot. And I think it was, for somebody who was in the field, who understood sort of the mechanics and the risks and all of that, the emotional component was all over the place, and I was very much unprepared for.
Yeah. There's so much to what you just described too, that like that's at a surface level, even it feels all consuming. But
Yes.
especially for someone with your background in medicine and understanding to a degree what was happening with your body. So you're torn between your instinct as a mom with a very wanted pregnancy and your instincts as a medical professional being like, okay, well, I know what all of this means actually. So, how was this is purely curiosity, and you don't have to answer if you don't want to, but how was the decision made in terms of what your treatment was, rather than surgical, having them do, you said it was an injection?
Yes.
Yeah.
So at that point, because I had never been pregnant before and I very much wanted to be, they did not want to in any way affect my ability, even if it was just a very tiny percentage risk or whatnot, decreasing my ability to get pregnant in the future. Again, I didn't have any risk factors, so they, didn't really know why this was happening, and if there was actually anything, physiologically going on with my tube that needed to be removed. And so they felt like this was the most conservative treatment option to protect my ability to get pregnant again. Since, the good news was I could get pregnant, as they would say, they would
Yeah.
tell me.
Yeah.
Not that that was a huge, a reassurance in the moment, but so I think it was just the most conservative option. And again, it sounded in theory like this is the easier way to go. I'm just going to get this injection and it's all going to be fine. But the mental toll, I think that treatment option took was, I really had never considered before. I'll be completely honest. I really did not, I was not prepared for that journey.
Yeah, that was gonna be my next question. Like, how did that affect your entire interpretation of what this journey was gonna look like for you?
Well, you know what, for again, like going back to that wanting to be prepared and having this timeline, I mean, it threw everything off because it wasn't just, okay, now we have to grieve this loss of this, very much wanted pregnancy, but it was also like now we have to wait. Like we couldn't even start trying again
Mhm.
for months after because, you have, like I said, first of all, my first injection didn't work. I ended up like after some period, I had to get another one. And then, then you wait for, the month or so for your levels to go back down. And you have to wait a full 3 months before you can even try to conceive again because of the risks with the medication. And so it just, again, it was like, all right, I want to move on. I want to move on. I want to try again, and I can't. And so it just threw off the timeline once again. And it really made me start to learn a very important lesson, which, I think, you know, in this particular case, if I'm going to look back at any positives to this, I think it was a lesson I needed to learn in terms of learning to let go of control, which I always say like motherhood is a crash course in learning to let go of control. But 100%. And for me, that started even before motherhood, just in the trying to become a mother phase, in having to let go of control of that too, and to get comfortable with the unexpected.
How did that first experience, affect your relationship with your partner? How were you guys supporting each other during that time?
So that's a great question. I think, fortunately, I had an incredibly supportive partner who was really there for me. And I think it actually redefined our relationship in a really strengthening kind of way. I think it brought us a lot closer together. Again, I didn't really know, except for maybe a few patients here and there, but that's a very different kind of relationship. I didn't really know anyone who had actually experienced an ectopic pregnancy, and particularly the way that I did. And so there was really no one, as much as I could. I told friends and I did tell family about it, but there was nobody else who could really understand the experience, who had lived it. And so I think that brought us together in a really powerful way. I don't think I realized, though, until my second ectopic, how much of a toll it had on my partner. And
Mhm.
I think part of that was because I was so in my own stuff that I don't even think I realized. But it was, I found out later how terrifying it really was for him, because in the back of his mind was, I could lose her at any moment. I could lose her at any moment. Right. And that's the messaging and the warning you're getting all the time. And it was like every ache and pain, this, and he's like, are you okay? Like, do I need to take you in? Like, so yeah, so I think that there was a lot there that was hard because, again, there is some benefit in just being able to talk about it and vent and share with friends. But because of the more, the rarity, I didn't have any friends, or I didn't have any people that I knew who had experienced this, this particular situation. And so that brought us closer together, but that was also really challenging.
Yeah, and that makes perfect sense. I'm curious, this is jumping around a little bit too. Just from other experiences that I've had the privilege to have shared with me, do you think that experience and your subsequent ectopic, which is absolutely insane, they're so rare to begin with, and then to experience more than one, do you think that there's a lingering effect from that? Do you think there's a lingering fear, maybe not on your part, but on your partner's part, of just that fear of, if something tiny is wrong, everything is wrong?
Oh yeah. And I think we never got to experience the joy per se, of like,
Yeah.
we're excited for it. Like we were excited, don't get me wrong, but we were terrified the entire time,
Mhm.
and I think a lot of people, probably resonate with that based on their own, losses and whatnot. I think once you have an experience like that, it's impossible to ignore the fear that exists. not just for the baby, but, for myself. And so yeah, absolutely. It made I talk a lot, about like our fear center and our amygdalas and whatnot. And I'm sure it made it much bigger. Like, it's like, I pick up on all threats now. So.
Yes. No, that definitely resonates. And I do like my main focus is you and your story, but it is interesting to me. You're not the first guest who has talked about how like I didn't realize how in what ways this affected my partner. And I think it's important to acknowledge that. And I'll be transparent with you. Like my partner from my birth trauma experience still experiences fear and trauma, even though I'm not having any more children, like anything like that. But so I bring it up only to sort of highlight the point that like these experiences that we go through that are so challenging and change us forever, they also kind of change our partners too.
1,000%. 1,000%.
Yeah.
Changes them. It changes the dynamic of the relationship, everything.
Yeah. So moving forward, I mean, and not brushing over it at all, but going through that experience with the ectopic and especially like having to wait so long and go through so much and kind of be on pins and needles for a while. When and how did you come to the decision of we're going to try this again? Despite the risks, we're going to try this again.
Well, it might sound crazy, but I think I was so determined that I wanted, like I said, I had always wanted to have a child. I was finally ready. Like I was like, we're trying again, like as soon as we can. And I also think, again, because they're pretty rare, I don't think it ever crossed my mind that it could happen again. I think it was like, all right, that was one and done. We were really unlucky. That was terrible. Let's move on. And I do not think it crossed my mind at all that there was a possibility that it would happen again. Whereas I do think that, for my partner, he was a little bit more like, are we like, sure, we want to go through this? And I was like, it's fine. Like, it was a one-time thing. People have ectopics and they go on to have normal pregnancies. Like, I think I was like back in doctor mode almost, in terms of like trying to reassure and like, here's the data and like, and this is fine. Like, so yeah, so there was no waiting period for me. If anything, I think it was frustrating that I had to wait as long as I did to try again. And then again, it was not quick, so it took us quite some time again, to the point where at a certain point, they did send us to a fertility specialist. And, the workup, everything was fine. Luckily, as we were about to start, discussions about our options, we got pregnant naturally and then ended up having another ectopic.
Yes, which is mind-blowing.
Yeah.
My gosh, what did that do? Like, such a simple way to ask such a huge question, but like when you have the joy of finding out that you're pregnant again, you're like, okay, yes, journey begins. We're going to do this again. It's going to be great. And then the moment comes that you find out that it's another ectopic. What was going through your mind at that point?
So actually, let me clarify, because I did just confuse things because this is mom brain.
Okay.
So I jumped ahead. I had a successful pregnancy.
Okay.
I'm like, wait a minute, this is not right. I had a successful pregnancy. And then it was in trying for number 2 that we did have the ectopic again.
Okay. So we'll backtrack.
Yeah. That's an important distinction.
It is an important distinction. And I thought so too. And I was like, I'm going to follow her lead because I think, but I'm not sure. Okay. So you got pregnant. You had a healthy pregnancy. But like you were saying before, you weren't able to truly feel at ease either.
Not
of
at
you.
all. Not at all.
No. How was the pregnancy? Was it a fairly, I hate the word standard. Was it a fairly standard pregnancy? But
I will say we were very fortunate. The actual pregnancy in and of itself was relatively smooth, no major complications or anything like that. I was very, very lucky. But yes, we were on pins and needles for everything.
Yeah, I can imagine. Yeah. In what ways were you able to sort of navigate that? And like, were you able to find some joy?
I think we tried. I think one of the things that changed for us, for example, I had been very like, oh, we're not going to share until after the first trimester, blah, 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 all this stuff. And, my husband actually was like, no, like we got pregnant. We're telling everybody, because if something goes wrong, like, you know what? We're probably going to end up telling people anyway. Like, their support is going to be helpful. It was helpful the first time where we were almost forced to tell people because we had to cancel so many trips and events and whatnot. We kind of had to let people know what was going on. And so he was like, this is our friends and I want to be able to celebrate it while I can. And I think that was his mentality. And I loved that because he was right. It was like, maybe this isn't going to turn out the way we want it to. We've learned that lesson, but we want to be able to celebrate it while we can. And I think that mindset reframe was actually really powerful and helped us be able to find some joy. Even though, like, behind the scenes, we were freaking out at everything. And I definitely, and I do not recommend this by any means. But, because I would see pregnant patients and I, would do the like I bought my own Doppler and I was like,
I knew you were going to say that. Yep.
Like, I am going to do everything I can to like check and make sure it's okay. And, that kind of, that almost paranoia in a way, it definitely stays with you. And as somebody who tries to control everything, I was like, I got to be prepared. I gotta be on top of this. I need to, feel like there's something I can do. So.
Yeah. Yeah. I knew as soon as you said, like, I don't recommend anybody do this, I was like, oh, she bought a Doppler. I understand why they make them. And I think that it's great. And I think it's a cool way that you can kind of like bond in the pregnancy period. But it also feeds anxiety.
Oh, yeah.
So much. Like every night you got to put the Doppler on and like yes.
Like I said, don't do it, but don't follow my lead. Do not follow my lead.
I'm really glad to hear though that your husband's encouragement felt good for you and felt empowering for you, because we talk so much about the cliche of the village, of building a village, and I think that needs to start before, maybe even like when you're just planning to get pregnant.
Yes.
To have that village surrounding you through whatever your journey looks like on this path to becoming a parent really makes a huge difference. And it sounds like it contributed to helping you find joy amidst a great deal of anxiety.
Well, yeah, I think, I love that you're saying that, building the village beforehand, because once you start sharing your story, it's amazing. I mean, this is like, firsthand, but it's amazing how many people, come out of the woodworks and they're like, oh, well, this happened to me and this was my experience. And you're like, oh my gosh, like, this is more common. Your specific situation might be different, but the idea of loss, the idea of complications, all these different experiences are actually, everyone's got their version, or a lot of people do. And so, yes, I think, podcasts like what you have, I think there's definitely more of a discussion and there's more of this openness going on, but there is still very much, this reality of like, we'll keep things hush hush, just your close circle until after the first trimester, make sure everything's okay. Although, we can all attest that that doesn't necessarily mean you're in the green, right? So it's like, why are we making these arbitrary cutoffs in terms of opening up that support? Because you don't know who is going to be the person who's going to be able to support you the most. And I think a lot of times we close ourselves off to just our immediate friends and family, but we don't know that it's the neighbor or the friend of a friend or somebody who experienced the same thing that you did, who actually is going to be the person that helps you walk through this, in a way that nobody else can, because they've lived it. So absolutely, I think that was, and I was always very open about wanting to talk about things. But, even for me, I think it was almost like I closed off, actually. I had almost the opposite. It was like, well, now I felt more closed off. And my husband was the one who was kind of like, no, like, why? Like, let's celebrate, and they can support us if it goes great, and they can support us if it doesn't go great. And, there's almost like there's no badness to that, right? And if they're not
Yeah.
the right people to support you, then they're just not, and they don't, come forward in that way. But it's okay, either way.
Yeah. I love I loved, oh my gosh, words. I love that you talked about too, like, you never know who it's going to be that's really going to come through for you. Because even though I think we've come very far as mothers and as parents in terms of it being okay to talk about the hard, I think it is still very stigmatized. And I think that's part of our culture of like,
Yeah.
shove your feelings down, put your
Mm-hmm.
feelings down and move on. And all it takes is one person to just say, like, this happened, or I'm not okay. And that allows these other people to be like, oh my God, me too.
Yes.
Oh my God, me too. And then a lot of the time, those are the people that you carry with you because you understand each other. Again, I'm referring to the village. We're fed the ideal that the village comes with parenting. You become a parent and this village appears. But no, you really truly do have to build it.
Oh, yeah. That village is,
Yeah.
if anything, non-existent, I think, in our current culture and society.
Yes. 100%. It's like, I'm sorry, what? I was told there'd be a village. So yeah, so you had a successful pregnancy. Baby was born. What was the birth experience like for you? And how was your anxiety during that time?
So I think, again, I always get conflicted in this because I do think knowledge is power.
Mm-hmm.
And I think because just of my background, again, in family practice, part of my training was, in delivering babies. So I had seen it before, variations of it. I think I was not scared of the birth itself because I had that knowledge, which I think was key because, it was like one less thing off my plate in terms of like
Yeah.
stress and emotional fears and all of those things, right? But that being said, I still wasn't good at expecting the unexpected. And I think that I was still very much like, I know that things can go a million different ways. I know that things are going to go wrong. I was personally not the kind of person who had a birth plan, right? Shocking, right?
Yeah. Yeah. Yeah.
Because I think I had seen enough to know that, like, a lot of times things do not go according to plan. And so I didn't want to set that expectation for myself. And yet I still found myself being disappointed in things. So I actually had a pretty seamless birth experience, besides the fact that my epidural sucked. And I only experienced it. I only like received the epidural in half my body. Both my pregnancies. I don't know
That
what's going
happened
on
to
with me. Yes, it's a
Yeah.
wild thing. And so like one half was cool, great, wasn't feeling anything. And the other half, I felt everything. And it was excruciating. But what was most excruciating was actually the repair process, which is also something I don't think we talk about enough with women.
Mm-mm.
And because my epidural wasn't very or fully effective, the repair was very painful for me. And I was so disappointed. That's when they put the baby on your chest. And so I was, like, I had been waiting for this moment. We had gone through so much. Like, I was like, I can't wait to hold my baby. And all I could feel was pain.
Mm-hmm.
I was in so much pain and discomfort during that whole time, to the point where, like, at one point I was like, can you please take her off of me? And I think, again, it comes back to that, these expectations, these stories that we're told, the scenes we see in the movies, whatnot, about this is what it's supposed to be like. You've been waiting for this. And then you don't get to have that experience. And you feel like you missed out, right? Like, I felt like I missed out on this beautiful moment that was supposed to happen that I didn't get to experience, after everything. Like, I want this moment. And so, but again, you I don't have any major like, issues. I think I got like a fever, whatever. There were other stuff that happened, but like nothing super crazy. The thing that stood out to me the most was having missed out on that moment, interestingly enough.
Yeah. And it's not uncommon. Like, it may seem like the most interesting or like, oh, I shouldn't be bothered by that. But that is something that is reported so often of like, we're, again, just like we're being sold the idea of the village, we're sold the idea of the golden hour. You have to have that golden hour. You have to have that skin to skin. And
Mm-hmm.
more often than not, it's not happening. It's not happening. And we do feel robbed of that. It's an experience that, especially after going through an ectopic pregnancy and a loss, and going through a pregnancy that was very full of fear and anxiety, yes, of course you would feel robbed of enjoying those first few moments with your daughter. Beyond that, once you were sort of settled and again, I don't know if you're ever settled after a baby enters the world, but no, there is no settling ever again. It's chaos. How did your village show up for you in those moments?
I think I, had a wonderful group of friends who was there. I think once I had the baby, this is something I didn't really talk about. I actually didn't really share about the ectopic at work. I had a lot of fears about them knowing that I was trying to get pregnant and what that could mean and all of this stuff. And so being able to share that, with my work community and whatnot, I think I had wonderful people around me, which helped. But, sometimes I feel like our worst enemies are ourselves in terms of, what, again, and I keep going back to the expectations.
Mm-hmm.
And at least for me, it's placing expectations on myself that I, couldn't change, I think. And feeling very sort of stuck in like, this is the plan and this is what I want to do. So for example, for me it was breastfeeding was a big deal. And I know it's
Mm-hmm.
a huge challenge for a lot of women. And I had counseled so many people on like, fed is best, whatever maintains your sanity, like that's what you do. And I knew all of that. And I don't know why I was stuck on I have to breastfeed, and I had a
Mm-hmm.
miserable experience. It took my entire maternity leave. I
Mm.
consumed my entire maternity leave trying to get the breastfeeding down. It was painful. I had mastitis multiple times, like, all of these different things. And it really, like, I can't say, I think I was pretty fortunate. I wasn't depressed. I probably had some anxiety going on, but it was more like that was the one thing I was like focused on. I was like, I need to figure out this breastfeeding. Like, I have to figure this out before I go back to work. And my support system was great. They were like, just do what you need to do. It's fine. Give them formula. It's like, it's okay. And I knew that. I tell patients that all the time.
Yeah.
And yet, we set up these expectations. I think we give meaning sometimes, right? Like there was a meaning behind that. There was I'm like, maybe I'm a failure if I can't do this, right? Or,
Mm-hmm.
maybe I'm not a good enough mom if I can't do this. I had clearly associated some much larger meanings to this very simple act that I knew was very challenging,
Yeah.
that like I knew was not a big deal if I didn't do it. My baby would get fed in so many other ways. So I do think that sometimes the community is really important in getting us through that. But I also think that a lot of times it's sort of our own internal work that if we've never done before, huge transitions like becoming a mom will put it in front of your face and force you to deal with in a way that you may never have had to do before.
And that, again, that resonates so deeply. I think so many cliches, and I always say I hate cliches, but I use them all the time. But like the easier said than done thing, right? Like I think all of us have a degree of that. And I don't know if this was your experience maybe later on down the road, but someone asked me once, like, would you say that to your best friend? And I was like, no. And why would you say that to yourself? Or why would you think that about yourself? It is challenging, though. It's not as easy as switching it off and being like, oh, yeah, no, I wouldn't do that. So I should treat myself nicer. We
Right.
have all of these preconceived expectations. So the expectations thing, that is a very common thing. And I think it's ingrained in us as mothers. Again, I feel like I'm glossing over a whole section here, but it was your daughter. You said you had a daughter first?
Yes.
Yes. So you have your daughter, you're settling in, you're dealing with the breastfeeding challenges, but again, like you're settling into this motherhood thing. You've got a support system and a partner that are very, very encouraging and empowering. And then at what point do you decide, okay, time for number 2?
Well, it's interesting because old habits die hard. So I was very much like, okay, well, my clock is ticking. Like I kind of, I knew sort of medically, like at this age, there's more risk, blah, blah, blah. So I think after, my child, and I knew like, biologically, it's like safer to wait, a full year or whatever it was. So I think about a year mark was when we were like, okay, let's start trying again. And again, that, throw that out the window.
Yeah.
None of that matters.
The universe was like, oh, that checklist of yours, if you haven't figured it out by now, we're not following that.
Right. It's like, clearly you didn't learn your lesson the first time, so we're going to hammer it in.
Oh my God. And we laugh because what else can you do? What else can you do?
So true.
So yeah, so you decided to try again. And again, that was when you experienced another ectopic.
Yes. So I had a chemical pregnancy, which is like a very early loss. I was like, okay, kept trying. And then I had the next ectopic, which, really, and again, I was very fortunate. I'm not, there are ectopic stories where people, the way they find out is they rupture and it's a very traumatic experience. I was very fortunate in that was not my situation. But the second time it happened, it was basically like, because I had the history, whenever I got pregnant, I got seen, very quickly after. It wasn't like a wait, till you're however many weeks to get an appointment. It was like, okay, like come on in. And so pretty quickly we started to notice that something wasn't right, even though I wasn't having any concerning symptoms the way I had the first time where I had been spotting and bleeding and whatnot. So I'm still holding on to hope. I'm like, everything feels good, guys. Like, and they were like, but I had a better sense of my dates at this point. And they were like, this isn't checking out. And they sent me to the emergency room because they were like, we really should be seeing something. We're not. And that sono they did, which was a lot clearer, they were pretty sure that there was an ectopic that they could see on the ultrasound. And so again, they came back to me and they were like, all right, so let's, we could do the methotrexate injection, blah, blah. And I just remember being like, oh my God, I can't believe I have to go through this all over again. Like that is worse. Like I was just like, I can't do that.
Yeah.
And thank goodness, the OB later came in and she's like, you know what, based on your history, like if you want to just do the surgery, like, let's just do the surgery. And I was like, give me the surgery. Like, let's do it. Like,
yes.
And my husband, who is non-medical and was like, I think he was having flashbacks of like oh my God, you're going to go to surgery. Like, what if I lose you? Like, what, like, no. And, but he was, he was very good about like, this is your body. It's your choice. Like, I don't even know what to say at this point. And I was like, take me for surgery. And so within hours, they took me in. And so, I had gone to the doctor that day, like hoping like, yay, we're pregnant again, and left that night, post-surgery, not pregnant anymore. But I think having had the first experience opened up my acceptance to hey, this is how it went, and my gratitude that this option for me and that particular point was a much better one and felt so much easier than what I had experienced the first time. So, I think if that had been my first experience, I probably would have had a very different feeling about it.
Right, but you felt empowered this time.
Yes.
Yeah, you had a little more autonomy in terms of what happened afterwards. Obviously there's grief involved. Obviously there's disappointment again and expectations that aren't being met. And you were given the choice of how you wanted to proceed, which makes I don't know, it's powerful. It's powerful. I don't know why I feel today like I'm fast forwarding so much, but your story is so packed that I don't want to miss anything. How old was your daughter at this point?
So she was probably a little over 1, maybe 1.5
Okay.
or so.
So she wasn't aware of what was going on.
And I have to say that was a relief because, it was a lot.
Yeah. Yeah. It's a lot to go through. It's a lot to go through a pregnancy when you have baby/toddlers, like any of that. That's really hard. But to also experience grief during that time, yeah, it's really difficult when your kiddos are aware of what's going on. That adds a whole other layer.
Whole nother layer for sure.
Yeah.
Fortunately, I did not have to. We were able to get away with not having to really address it so much, besides the mommy's recovering and, she can't be picking you up right now or, things like that.
And I'll have a question about that after. But I think before that, in terms of, again, going back to your checklist and your timeline, I'm assuming you were pretty eager to try again. I'm noticing a pattern here, pattern recognition. So how soon after, was it as soon as you got the all clear from surgical, did you start trying again?
Yeah. And, and honestly, that was a big part of my decision because I was like, I don't want to wait months and months and months and months, knowing that for us, it does not happen quickly,
Yeah.
So we did start trying as soon as we could.
Again, because I don't think I have this in my notes, but did the next time result in a successful pregnancy?
Yes, it took a while, but then we had my son. And so it's amazing. You truly do not need 2 tubes to have a child.
Yeah.
But yes, so then that went well.
What did you have some of the same feelings going into that pregnancy that you did with? Yeah.
1,000%.
I have listeners, listeners, the face said it all. Yes, obviously. And you add I don't even think we're going to get into the full breakdown of it today because we'd need hours. But the whole idea of burnout. So your experience, you just went through another ectopic pregnancy and loss. You have a toddler, a tiny toddler, and you're pregnant again and you have all the same anxieties that you did in your first pregnancy, and you still feel like you have to do it all. You still feel like you have to show up.
Well, let me add on top of that, we were in COVID during that time.
Yeah.
So as a medical provider, it was insane. And I had been working in a really hard hit area with, where we didn't have appropriate PPE and all of this stuff. So there was a lot of just burnout from my work. And then I found out actually that I lost my job a week before I found out about my second pregnancy.
My God.
So because, a lot of medical offices, there was a lot going on with COVID and they were really, struggling to, there was a lot, right? So it was a lot more commonplace. There were a lot of layoffs happening, whatnot. And so there, yes, you want to talk about emotional stress, the unexpected, being out of control. I mean, it was everything kind of all at once. So there was a lot of fear around the pregnancy, but a lot of, and we were talking about cliches before and how I hate cliches, and I hate this one because I know it can be really hurtful for people sometimes, but for me in this particular instance, it helped me in the whole everything happens for a reason, because I was like, you know what? I would have had so much more anxiety had I been working in the office, pregnant, during COVID, feeling like I didn't have the adequate PPE and all of that, where at this point I was able to just focus on the pregnancy, obviously trying to find another job and all of that. And I ended up, eventually finding a job where I was remote and worked from home. I mean, it was just all these pieces that helped to really address some of the burnout that I had been experiencing, right? So it was very interesting how the world worked in that moment, that even though it felt like everything came crashing down, looking back in retrospect, I'm able to see sort of how I was able to take that and actually make it something that worked beautifully for my family, and that I can actually be grateful for in some ways. Because I think the other thing with burnout is that you often don't realize when you're in it and you're just feeling sort of this constant stress and this overwhelm. And you might pinpoint it on one thing, right? Like I was really pinpointing it on my job. But really, it was sort of the mix of everything. It was we were trying to get pregnant again and it wasn't working. I had the ectopic. And then, I was trying to take care of this toddler who, and not really able to give her the attention that she needed and feeling guilty about it. It's like so many things, right? That all contribute to this overall sense of burnout. And I don't think I was even really recognizing it in the moment. And so it almost happened for me, I like to think of now, it was a whirlwind.
It was a whirlwind. And yeah, so even with not knowing a whole heck of a lot about you, like when I was trying to break this down into an episode, I never try to structure things because I want things to happen organically, but I'm like, holy moly, how many times did the universe have to deal her a hand of cards? And like, how are we going to even scratch the surface? Like, oh my gosh. And I appreciate you acknowledging that the everything happens for a reason thing is challenging. It's challenging for me. It's challenging for a lot of people. But I do 100% see where you're coming from. And I've had similar situations where it kind of feels like, again, I say the universe, some people say God, some people say whatever, but it's like it is forcing you to slow down, take a step back, and reevaluate.
Yes.
Again, like we've been talking about those expectations or those check boxes or whatever. So yeah, what was a perfect storm sounds like set you up to where you are now.
Yes, very much. Very, very much. I think, and like I said, I think we each have to find sort of the cliches or the, mantras or whatever that work for us in the season that we're in. Like them, I want to be very clear about that because I do acknowledge that it doesn't work for everyone and it can be triggering for some people. But for me, that was really helpful in that moment as I was going through it. And it did set me up. I agree with you. I think the universe, really wanted to teach me a lesson and was like, you're not learning it. You're not learning it. So, until
let's throw a global pandemic in.
Yes. So I'm happy to say, I think I can't say I've learned it 100%, but I have made significant progress. And yeah, that has really informed a lot of the work that I do now. One of the interesting things with having practicing medicine and being a primary care provider was that I always saw women who were coming in, or patients, everyone, but particularly mothers who were coming in and they had a lot of physical symptoms, right? Like they are coming in because their hair's falling and thinning, or they're not sleeping well, or they're having a lot of heartburn or indigestion or all these different things. And you do all the workup and everything's normal, right? And you tell them that. And then, and being on the opposite end, like I understand, and then you'll be like, well, are you really stressed? And they're clearly very stressed. And you're like, well, maybe it's like the stress. And it's like, well, what the F do you do with that?
Yeah.
And it's very frustrating for the patient. And it was really frustrating for me because I felt like I didn't have the tools to help these women, or these mothers or parents who were going through these things. And I could tell your physical symptoms are very much related to your stress. That they were also many times feeling, if not burnt out, on the trajectory. And I didn't know how to help them. And then when I went through my own journey and I realized my support was not coming necessarily from the medical professionals that I saw, because I didn't, fortunately, I didn't meet the criteria, let's say, for postpartum, anxiety or depression or whatnot. I would go and I would do the screeners, but I wasn't meeting the criteria. And so there's a sense of, okay, well then you're fine. This is just normal postpartum. Like, this is the season of life you're in, right? And I would hear that all the time from, like, even well-meaning friends who were years ahead of me, and they're like, well, it's just the season, right? And yes, it is the season, right? And there's a lot of challenges in that season. However, I just was not okay with saying, that's just how it is. Suck it up. Like, you got to get through it. Right. And for me, I felt like we're starting. We need a lot more resources and support to help with, PMADs and other diagnosable conditions. But there is this subset, which is where I felt like I was, and honestly, a lot of my patients were too, where they're not diagnosed, clinically with a particular, anything, but they're struggling and they are silently struggling, and they feel like they're the only one. And they feel like everybody else has it together and I don't. And how can I, I want to be able to do it all. And what does that say? Because I can't, blah, blah, blah. Like, we know the story.
Yeah.
And so for me, I had to do a lot of internal work because, as we can tell, I had a lot of things to work through and to learn. And so when I realized that, like, there are tools, there are strategies, there are mindset changes, there's, a lot I can learn about nervous system regulation. Like, I never even heard the word nervous system regulation. I mean, I went to medical school. Like, that wasn't something I learned.
Yeah.
There were all these, it was like a whole nother world open up to me. And I just felt like I had to share this with other women. And so that really propelled what I do now in terms of the coaching that I do. And it's really informed on a lot that I learned and a need that I saw that just really wasn't being addressed. Because I think that a lot of times these stressors and overwhelms that women feel are just, they're normalized. And so they're dismissed. And I don't think that's okay. I think there is a lot that we can do. We can't control the lack of support and resources that exist for parents nowadays. We can certainly advocate and fight the fight.
Yes. Yeah.
But we can't make it just show up, out of thin air all of a sudden. So it's like, what can you do now? What do you have control of that can make your life a little bit easier, a little bit less stressful, a little bit more manageable? Because there is a lot that we can do. And I think we have learned a lot of stories that we've told ourselves based on, society and culture and the different beliefs, family beliefs, all of these sorts of things that keep us stuck in that place of stress and overwhelm. It doesn't need to.
Yeah. Oh my God. So many things you wrapped up in that, minute and 30 seconds, that are huge, that are so huge. There is a systemic issue in terms of support for parents, especially mothers. And of course that burnout culture, we're learning more about burnout culture and how the way that we are living our lives in this country is not sustainable.
Mm-hmm.
Bounce back culture and all of these things that just kind of set us up to fail and also set us up, just like you were talking about earlier, to feel like a failure. So you may not, in all likelihood, you are not failing. You're not failing.
Absolutely not.
No, but you feel like a failure because of the standards that are put on you. All of those things were shouting in my head as you were explaining that. And also just that I had another guest ages ago, as of recording this. I don't know when that episode will be out, but she said, I didn't have postpartum depression. I didn't have a mental health disorder, but I was not happy. I did not like it. I did becoming a mother. She's like, I didn't like it. It was not what I expected. I didn't know what I was feeling. I didn't have postpartum depression. And that is her story. And that's, but what you were saying really, I think, is a great example of that. Also, I hate the Edinburgh scale that they give all pregnant people. I hate that. Let's just put that in there.
Yep.
But I think you're absolutely right that the overwhelm, the lack of information, the feeling isolated, and the people not sharing their stories all combined create this entire generation of moms and parents that feel like failures and feel completely lost. And just like you said, we don't have the exact same story, but it's people like you and people like guests here and people on social media opening the door and saying, hey, I'm not okay. It's okay if you're not okay too. You can sit with me. Like we can sit in the not okay. And in a little while it'll be okay. And there are tools that can help us get to that point.
Right.
But it really is just cracking open that door a little bit to let the light in so other people can see again.
Yeah.
You know what I mean?
I think just to normalize it, really.
Yeah.
To say that, hey, it can be normal that you're feeling this way because of all these things that are not your fault.
Yes.
And you don't have to keep feeling this way. There are things that can be done, right? You don't have to feel like, well, this is just it, right? And have no hope. I want to be able to give people hope, right? And I think that that's a big part of what carries us through, especially nowadays where we are inundated. You know, I mean, you mentioned all these external factors, and the one that I just want to add quickly is like social media, while a blessing, right? That's how we found each other.
Yep.
But in another way, it's like this other domain of just overwhelm, right? That comes in about like, well, these are all the things I should be doing all the time. And these are all the, you know, and am I researching like the clothes that my baby should be wearing and what formula they're having and am I doing this right and their sleep schedule and blah, blah, and that in and of itself, right? We can get inundated in all of that, which just feeds the anxiety and the stress and all of the things. So it's, you know, I think a lot of times it's learning how to simplify and how to really get in touch with what we know and what we want, which I don't think we give ourselves enough permission. We keep thinking like, oh, we're doing it wrong. Everybody else has the answers. And it's like, no, like you're a great mom. Let's just put this out there. If you're listening to this podcast, right? It's because whether or not you've had a child yet, you know, you care enough to like to inform yourself, to just be aware, right? Like you're great.
Yeah.
Let's just put that out there. And I think that we need to have a lot more trust and faith in ourselves and our own abilities and to be more in tune with that, which we don't do enough of. And, you know, sometimes that's the process, is really learning how to trust yourself and be in tune with yourself and simplify the noise and all of that. So,
yeah. Yeah. I love that. I say that all the time. But that is a very, very succinct way to kind of sum up a very big idea. Give yourself some grace. Before I get to my wrap-up question, which I love, I'm trying to add a few more, but I usually have two and I wait until the end until I get to know you better and I choose the question, and I think I have yours. But before I get to that, because I want my listeners to be able to learn more about you and learn more about what you're doing to help other mothers feel seen, where can they find you? And they will all be listed in your show notes, so listeners, please check the show notes. But if you don't, Sandra, if you could tell us where we can find you.
Sure. So I am on Instagram, TikTok, Threads. And my handle is Sandra Fernandes, MD. Fernandez ends with an S, not with a Z.
Yes.
Just to clarify. So Sandra Fernandes with an S, MD. And then my website is sandrafernandez.com.
Perfect. So again, check the show notes because there's good stuff in there. But if you don't, now you know where to find Sandra, and you definitely should check out her stuff so that you can learn more about her and learn more about what she's doing, because you're doing amazing things. So yeah, so I think to bring us home, you just gave a beautiful sort of message to people listening in terms of how they can give themselves grace and how they can maybe lower the standards a little bit or lower the expectations a little bit. Let's think about you long before the journey to parenthood, like before even trying.
Mm-hmm.
If you could instill something within yourself, you can't tell yourself what's going to happen. I know the control part of you wants to be like, oh, we'll plan for this. You can't tell yourself anything that's going to happen, but you can instill, it can be a word, it can be a phrase, it can be a feeling to carry you to where you are now. What would you instill within yourself?
I think I would tell myself to start feeling comfortable with the uncomfortable.
Mm.
I think that felt like a very unsafe place for me. I think, that's hence the control and the perfectionism and everything. And I think learning and allowing myself to kind of practice that, and that's a lot of, for example, in nervous system regulation and whatnot, like you do a lot of sort of that titrating and that practicing of being in these quote unquote, like, I want to say unsafe situations, but like allowing yourself to experience failure, to experience discomfort, to experience, things going wrong. I think I wish that I had been more open to that and known that that's okay, right? And that the more I practice that, the better I will be able to handle life, because it was going to force me to practice that in ways I wasn't ready for, and I didn't feel safe handling. And so I think, for a lot of us where we want to have control and we want to plan and we want to learn everything and we want to do all the things and we have the checklist and we want to succeed, right? Learning to be a little bit more comfortable with the uncomfortable is going to help us in every single facet of our life, and probably will make things not just a little bit easier, but a little bit easier to have compassion for yourself, So I think it kind of ties in with having that self-compassion, right?
Yeah.
We were talking about, but sometimes it's hard to say like, well, how do I have self-compassion? And I think those are the moments that we really learn it.
Yeah. I think that that's absolutely beautiful. And it's a journey. It's a journey I'm still on, sitting and being able to sit in the uncomfortable. Yeah, that's amazing. Very on brand. Well, like I said, I so appreciate you not only being flexible with me, but choosing to share your story with me, as much of it as we could fit into this time frame. You're always welcome back. But yeah, I thank you for what you have shared with us. I thank you for what you are doing to help others feel empowered in their journeys. And thank you for being here with me today.
Thank you. It was such a joy to be able to talk and feel seen and heard. And I love that, you're doing that for so many people as well.
Huge thanks to Sandra for sharing her story with such honesty and heart. If this episode spoke to you, consider sharing it with a friend who might need to hear it too. You can find Sandra on Instagram at Sandra Fernandes MD, Fernandez with an S, or at sandrafernandez.com. Both are linked in the show notes. And again, if today's episode resonated with you, we'd love it if you'd left a rating and review on Apple Podcasts or Spotify. It's a small act that makes a big difference, and it is so appreciated. Want to stay in the loop and connect with our community? Follow us on Instagram, Facebook, YouTube, Threads, and Blue Sky. We're sharing real stories, resources, and reminders that you're never alone in this. You can find us at Quiet Connection Podcast. If you'd like to support the show and gain access to bonus content, early episodes, and other goodies, check out our Patreon or Buy Me a Coffee pages. Those are also linked in the show notes. To share your personal journey, you can reach us through our website, quietconnectionpodcast.com, or by email at quietconnectionppmh@gmail.com. Join us next time when another story is told and you realize you are not alone. I see you.